So two questions. The first is really following up on this discussion that we're doing right now. So in this move from the one-size-fits-all thing to a portfolio approach, there will be limitations in what the assessment can do, and I think I'm getting a feel for how that will work, but it doesn't sound like every problem will have the same solution. So is there a way to clearly and succinctly identify what the limits of a new kind of fit-for-purpose assessment are? Because right now, people basically go to the web, they find an iris value, and feel like they're good to go, and that's obviously going to change. So how do we communicate that? How do you communicate?
Yeah, so that's, do you want to say? So that's going to be our challenge, because we're building it. One of my worries was it's very classic at EPA to conceive of new ways, next generation this, put out a description of it, and then have nothing to show for it. So maybe it's because of my ComTalks background that I've learned what works is do it, show it, do it a few more times, and then see how that narrative unfolds, run into some challenges, deal with the challenges, and then pause and describe the narrative. So a little bit of a bottom-up approach, because the top-down approach worked really well theoretically, but we almost never had anything to show for it. So now we're taking a bottom-up approach by doing, showing, and then so for example, most recently, we were working on a manganese assessment, and we had to make some of those difficult choices. But by bringing together a very sophisticated team, we're proposing an approach that will be by itself controversial among our internal EPA aficionados of risk assessment, because it's a significant narrowing of the scope with a very well done sensitivity analysis that will demonstrate that given the data, the capability, and the science, the value that we produce was extremely public health protective, that going for that one-size-fits-all in the case of that assessment with our current today capabilities would probably not be worth the bang for the buck. Now, we haven't survived that internal storm yet, or we would have had that here as an example with you, but that will be an example. Once we go through it and once we work through with our stakeholders, we will see what the boundaries of this expansive portfolio concept is. I don't know if you want.
And I think, too, that sort of conceptually, it is very hard for people to understand, well, what does that look like? And so if you look at some of the IRIS assessment plans, they actually have specific aims, which is where you see, and this would be something, one of the first documents that would go out for public engagement. So it's very clear if there is some sort of trimming or targeted focus, it's very clear embedded within the specific aims. And so I think over time, as you have those more examples, then I think it becomes clear what is needed. But again, the idea is that we wouldn't get to the point of having sort of an IRIS assessment plan unless we felt that the specific aim was addressing an agency need.
Does that help?
It helps. And then the second question is, in the one-size-fits-all approach, there was usually an annual goal of around 6 assessments a year. Do you have an estimate of what your output's going to be with this portfolio approach?
What we're thinking for, we use the punishing timelines of TSCA as an excuse to say if we are hoping to be meaningfully useful to TSCA and supportive of their activities, they're doing their own assessments, but we will be providing scientific support as they ask, is that we have to be able to get a draft assessment done within 2 years and peer review an additional year. So we're aiming for that 3-year cycle. And in some cases for faster than that. So you'll see that today with the chloroform and uranium, for those targeted assessments, we did it essentially in a year. We used some of our most senior scientists to get that done, but we're showing that we're exercising a lot of responsive tools to really be able to turn these around. Now, you don't have to take my word for it. Just let's see if we can actually deliver on this. That's our goal.
And I would add too that as part of that is we want to have a mixed portfolio of assessments. So not everything should be a formaldehyde. And so if you look at things like the chloroform and uranium, they're actually very targeted. So not everything should be huge. And the other thing in terms of the two-year clock, we're talking about sort of the time frame when we first got with this assessment plan till we think we have a draft, recognizing that for many of these, there's a lot of internal discussion to do the problem formulation and the scoping till you get to the point of this is the sort of the specific question that we're trying to address. So the two-year clock that Tina's referring to would really be ideally from assessment presentation to the public to having a draft for internal agency review.
Lauren? And then down.
Well, I wasn't sure if this is a question for now or later after a comment that you just made with respect to the portfolio, but I was wondering if you could go into a little bit of more discussion of your approach to building on existing assessments and how you make those decisions.
Well, I think it's going to vary. In some cases, depending on the source of the other assessment, if systematic review has already been applied, so there's individual study quality assessment, some sort of structure framework for confidence, then we can probably lift more of it, presuming that sort of the evidence, the question is sort of what we need it to be. In other cases, and more typically, I think if you think about an ATSDR document or a state document, we can at least try to take the literature search identification. And we think that from there, we can probably look through that, get a sense of the kind of key studies that are going to be informative for toxicity value derivation, and maybe just lift those studies from that other assessment, apply our approaches for study quality evaluation for structured frameworks. So that's one, and that was something that's been articulated in the nitrate assessment that was released last September. Also in the uranium IAP, if you read that, you'll see it's the same. We're building off of a 2013 ATSDR assessment for the uranium. So I think we're going to be probably at a minimum trying to rely on those assessments to identify the core studies. And then you'll also hear later, as part of our sharing of protocols, we try to put out a list of studies that are considered included fairly early on. So that would be one way to sort of get feedback on if an assessment might have missed an important study, then we can get engagement that way.
And in this partnership, we'll be relying very heavily on the state agencies, in addition to the federal family, who have that capability. So, for example, we spent some time recently with the state of New Jersey's public health DEP because they have very significant expertise in risk assessment. So we shared our tools with them. They shared a lot of their experience and learning and where things have worked and have not worked for them. And so we expect to go through, we're hoping to reach out to Texas next. So we have a list as we go through these partnerships that we're going to build, because as awesome as we may be, we are not going to be able to do this all by ourselves. And it was a fallacy to think that we could to begin with. So we think that there's a richness in the community that we can draw upon. And if we use these methods to transparently communicate what we did, where we started, how we did the work, I think it'll make it very successful, we think.
Karen.
Could you speak a little more about the role and the process for external review within the approach?
Yeah, so I guess, so we have a draft assessment that's developed within NCEA, and then that gets shared within the agency, so internal to the agency for comments. Then that gets shared across agency for comments. It also goes out for public comment. And then there's an external public peer review of that document. And then there is a period of time where we respond to those comments and then sort of go through another, within the agency, have we been adequately responsive to the peer review report? And then there's a final posting.
So that is a sequential process. So imagine something like formaldehyde, on the scale of formaldehyde. It will go first through an agency review. That might, it's a large document, so that could take anywhere from 1 to 3 months. Then it'll be posted, then it'll be shared with the other federal agencies. We've had this agreement. This is another reason why the IRIS program has the support that it does, because the federal family gets an opportunity first to see that document. That includes the health agencies, includes the Small Business Administration, it includes OMB, it includes that entire community gets an opportunity to discuss and evaluate and really do a peer review of the document in that space. That takes several months as well. Then we post it for public comment. That's another several months. And in between these steps, of course, we pause and respond to the comments. Not respond, but incorporate and consider those comments in improving the drafts. And then it goes to external peer review. And the external peer review by itself has additional public comment period as well. So when we first got there, we said, this is nuts. We got to kill it. That's not going to work. Well, little did we know how important, how valuable that process was, and how it was the reason why the IRIS program had the support that it did was because of that process.
Thank you. Just a follow-up. Can you speak to other stages within the IRIS approach when you seek or may seek external input?
Not until it's published. So unless we somehow have an agreement, let's say a colleague from the National Toxicology Program, like John Booker, is on our disciplinary work group, that they get to review the interim drafts. If the document is not public, it's just not public. So it stays within the agency. It doesn't get additional external review.
Right. But we do have, during the process of preparing the draft, the option to seek out external expertise to help develop the draft.
Through these MOUs that we
Through these MOUs, through contract mechanisms,
Right.
to get sort of a targeted expertise. Obviously, in sort of the budget times that we're in, we may have less ability to procure these services through contract mechanisms. So we're really, trying to rely more on the federal family through the MOUs.
Yeah, so for example, especially DOD has a lot of expertise. They might jump in, as I said, on TPA, TSCO, of course, and the states. But by definition, the document as a whole remains within the agency until it's allowed to go public.
Dave has a quick follow-up.
Really quick follow-up, then when does it go to the CAC? So after it's,
That is a peer review, it's at the very end.
so after all of the public comments are completed, the interagency
And CAC
review,
has its own public, independent of us.
right, so that's one more step in the process of peer review, so, okay, just to clarify.
Yes, the CAC is the peer review, the external peer review. And not everything necessarily will go to the CAC, because some things are smaller. There may be other mechanisms for peer review. But our goal is, between the CAC and the Academy, to do most of our prominent assessments in that manner.
Leon.
Can you explain a little bit more about the way you create discipline-specific work groups? Specifically, does this group include external members or just EPA or people inside agency? Is this a routine practice or it's a case-by-case situation? If the latter, how decision is made in terms of when and where a work group is needed?
So the disciplinary work groups are standing work groups, and you will meet many of them over the next 2 days. First and foremost, they're comprised by our experts. So our PK work group, for example, comprised of our NCEA experts with an executive leadership. So you'll see Victor Marzov behind you is the executive shepherd for the PK work group. But then that PK work group has auxiliary or family membership from across ORD. So we have all our PK experts, either because they're modelers themselves or they're users of models with extensive experience, are part of that community. And then depending on the chemical, we may augment that PK work group standing group with some additional members. Let's say if we're focusing on lead, we bring, I don't know, Jim Brown from the ISA program with extensive lead expertise into that mix. So that's how that, but these are standing work groups and they're involved within, so as I said, systematic review, the EPI, these are very, very active, and you'll meet many of them over the next 2 days. Recently, we've started, especially more formally, using our MOUs to augment these with expertise from health agencies, as I said, from HHS especially, and ATSDR as needed. So, for example, Matt Wheeler is involved with us. As I said, it's John Bucher. That's been especially important, especially when to deal with some of the complexity without relying. But for none of our work groups do we have external, completely public members as a member of those, because again, the assessment development process is very much an inside the agency activity.
And just one more thing to add, we also have sort of a liaison to that group who's helping to anchor the needs of that group to the project management,
yes,
to the workflow, so that we can try to calibrate the timing.
Right, so we don't suddenly do, although we do, but we try not to do, 5 assessments that require complex PK modeling, all at the same time as we're trying to help the Office of Water with perchlorate, for example. That was the case yesterday.
Follow up, just with the current trend, are we afraid that you're going to lose a lot of expertise within the agency that at some point work group is,
Yes,
becomes not feasible at all?
We're terrified of that, But what we've also tried to do, as hard as NCA's job is, assessments are probably some of the hardest areas of science with the least rewarding experience, right? If I can say so myself. It was so much more fun in ComTalks. It was all nifty and cool and fun, and Congress loved us. Everybody loved us. So it's a very different, being on the assessment side is very, very different. So we're terrified of that. But amazing is that as we have been given permission to do recruitments inside the agency, we have been able to recruit some pretty incredible talent who have wanted to be involved in the practice of assessment. So we've been doing okay recently with some of these recruitments. The question is, if the overall headspace is reduced, then it doesn't matter where we find the experts, we won't be able to hire.
I wanted to follow up on comments you made a little bit earlier about a shift from using more external contractors to having to train more people internally. So could you just say a few words more about what it is you're losing in terms of the expertise and what it is you're training the internal people to do, and what you see as the pros and cons of that going forward, et cetera?
Well, I think it's everything. I mean, there would be a variety of levels of engagement between individual assessment teams and contractors. But in some cases, it might be everything from help us do the literature search, screen the studies, evaluate the studies, think about the evidence synthesis, whether we need sort of additional pharmacokinetic or modeling expertise. So it could span all of that. I would say that the parts that have been easiest for us to sort of bring in-house would be a lot of the more the front-end stuff, screening studies, having approaches for looking at the quality of individual studies, structured frameworks to reach your confidence conclusions. We still would struggle, of course, with the bandwidth of sort of having the pharmacokinetic expertise or the models. But I think the front-end stuff has been fairly easy to bring in-house, and we've tried this train-the-trainer approach. So we've had a number of sort of deliberate training sessions for all staff, but recognizing that a lot of times you don't really learn unless you actually need that task. And so we've had support teams who have been sort of more conversant on those aspects we've taught so that they can be available to teams when they need it. So it's been through that process.
Right. So things like epidemiology, like biostats, like PK, those continue to be vulnerabilities that we used to be able to use our contract mechanisms to engage experts. We won't be able to do that, but we've also then now used as an excuse to put a call out to hire from across the agency a couple of epidemiologists and some of these expertise as well.
And I would say in the short term, the benefits have been huge, actually, in terms of really trying to bring the IRIS program up to speed and feeling like they understand all these phases of systematic review. That's been an asset. But I think in the long, and I think anticipating a time when maybe we have more extramural resources, then obviously these staff are now in a position to better oversee the quality of what a contractor might do because they understand the process from the inside out. But I do think having sort of these disciplinary bandwidth issues, that's where we're really, that's hard to mitigate.
And this group may not know this, but we've been using tools like leaning and sprinting. I'm going way out of my comfort zone here, but we apply these tools to identify a lot of these vulnerabilities, streamline some of our workflow, and get a better understanding of where the system gets clogged. Is it just clogged because of a deficiency, or it's just bad planning? And there's cases of both. So where it's been bad planning, we're now able to remedy it because we use our project management capabilities. And where it's just a deficiency, we've either redefined the scope or steal and plunder from across the agency. So far it's working, but we've been at it only 12 months, so you have to see if we can keep this up much longer.
Hey, Russ.
Sure. Tina, you had mentioned that Tosca's doing their own assessments. I was wondering about kind of the interaction between IRIS and Tosca and potentially the use of the IRIS documents by Tosca and how you envision that.
Yeah, I think Teresa invited Nancy Beck to come and address the best on this a month or so ago. That is an evolving activity, Russ, and I think the concept originally was that when Tosca was promulgated, that the collaboration would be much more explicit. But as it's now being implemented, I think Toxic's program is worried about being maybe dragged into the controversies of IRIS, and they'd rather give Tosca the fresh start it deserves. So it's an evolving relationship. So for example, they have their own work groups around their chemicals, and our scientists, many of whom you'll meet, are serving as experts on those work groups, helping anything from scoping and problem formulation to systematic review. Emma and her colleague in the OCSPP, they've put up this systematic review community of practice where we're sharing our experiences and doing a lot of the training. We are, for one of their first 10 chemicals, HBCD, we had pretty much a significant component of an assessment completed, but since that's a critical Tosca priority chemical, we got it to a certain point, completed the systematic review and the analysis, and then delivered it to Tosca for their use, and they will put it through their own review process. So I think at this point there's a lot of collaboration, but not a lot of commingling, because the issue is they don't want to drag the IRIS controversy into their space, and they're building their airplane as they go. So I think we're going to have a lot of commonalities around the access of systematic review, but they're not likely to directly use an IRIS product. At least that's our sense right now. Would you agree with that?
Yeah, I would agree. And I would say it's almost a little bit like an a la carte engagement. So, we've adopted a lot of specialized systematic review software applications. And so we might tell them, well, here are some tools out there to help with screening. And then they can sort of absorb that and ponder that and think about which work best for our workflows. And so that's sort of how the staff to staff level engagement is going in terms of how we're trying to use our expertise to at least sort of introduce them to lessons learned from making systematic review pragmatic.
So why don't we, actually I'm going to suggest we move on because I think this is a little bit outside scope of our statement of task. So I'm a little worried about time, and I think, Lauren, last question, hint to the committee.
And this question, again, might be better explored later. So, and it's a question around what the ultimate goal of the assessment is. and the extent to which the portfolio approach might be shifting it a bit. Is the overall goal for, let's say we have a chemical that has multiple endpoints, maybe very deep database, well studied in the past, so you're building on a huge amount of evidence. Is the overall approach to kind of move towards these quantitative values associated with that, which will protect the entire population because it's the most sensitive endpoint? Or is there an additional goal to be able to describe the spectrum of sensitive outcomes, some of which may not or may be in that lower part, the very low part of the dose response range?
And one comment before you answer, because I think that's a question with a potentially very complex and deep answer. We may be in a better position to return to it tomorrow. So why don't you, if you want to quickly respond to Lauren, but I suspect we'll come back to this after we better understand the portfolio approach.
I think it's going to depend on the decision context, and it's probably going to be a mixture of both. Our ultimate goal is public health protection. The goal is not to produce a value for every endpoint. It's to produce the value that's going to be useful and informative. But we also have learned that it is really important to inform the spectrum, because the worst case scenario or the most sensitive endpoint may or may not be applicable at all times. So we're doing the work we're doing, and you'll hear some of this from Jason Lambert with Rusty Thomas's Contact Center, also allows us to do a little bit of prioritization and get a back of the envelope sense of the ranges of PODs. What does that portfolio of PODs looks like, and where do we need to sit in there to best capture the diversity of that information? So I'd say that all that is work in progress. But you'll hear more about it over the next 2 days. Would you say?
Okay, thank you very much, Tina and Chris. So.